Well, good evening once again. Day 1209 of the Trump administration. 175 days to go now until our next presidential election. And tonight, once again, the news is in the form of a projection, and it's grim. Tonight, a leading model often cited by the White House is out with a startling new projection for coronavirus deaths. The Institute for Health Metrics and Evaluation now predicts a death toll of 147,000 by the first week of August. That's up 10,000 from the last round of projections just 2 days ago. And a reminder here, these projections have amounted to a moving target, and these days they are based on simple math, and that is what the doctors and scientists are seeing in so many states that are opening back up, in quotes, the people who are getting back out, gathering once again, the very activity the virus depends on for its own survival. Tonight, and this never gets any easier to report, our current death toll stands at 83,421. At today's Senate hearing, Dr. Anthony Fauci noted that he and the other experts now believe that the daily toll from the virus is higher than being reported.
Most of us feel that the number of deaths are likely higher than that number because given the situation, particularly in New York City, when they were really strapped with a very serious challenge to their healthcare system, that there may have been people who died at home who did have COVID, who were not counted as COVID because they never really got to the hospital. I don't know exactly what percent's higher, but almost certainly it's higher.
Dr. Fauci then had this warning about what happens if we move too quickly to reopen.
My concern that if some areas, cities, states, or what have you, jump over those various checkpoints and prematurely open up without having the capability of being able to respond effectively and efficiently, my concern is that we will start to see little spikes that might turn into outbreaks. There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery. There's no guarantee that the vaccine is actually going to be effective. You can have everything you think that's in place, and you don't induce the kind of immune response that turns out to be protective and durably protective. So one, the big unknown is it will be effective. Given the way the body responds to viruses of this type, I'm cautiously optimistic.
Here's why all of that matters. Dr. Fauci's warning, of course, comes as more states are lifting their stay-at-home orders and allowing for the reopening of businesses, a move the president supports as the pandemic has, of course, flattened our economy. Some communities are still cautious about reopening. Health officials in L.A. County are saying that some stay-at-home regulations could be extended for 3 more months. California State University, the nation's largest public college system, will keep all 23 campuses shuttered this coming fall, moving all classes online. As states try to get back to life before the pandemic, there continues to be a lack of widespread testing. Less than 3% of our U.S. population's been tested so far. Yesterday, Trump and Assistant Secretary of Health Admiral Brett Garrar announced an effort to help states expand testing while also claiming the U.S. had surpassed South Korea's number of coronavirus tests conducted per capita. Trump even boasted that the U.S. had prevailed on testing. Well, during today's Senate hearing, Mitt Romney made it clear, Admiral or not, he wasn't buying it.
I understand that politicians are going to frame data in a way that's most positive politically. Of course, I don't expect that from admirals. But yesterday, you celebrated that we had done more tests and more tests per capita even than South Korea. But you ignored the fact that they accomplished theirs at the beginning of the outbreak, while we treaded water during February and March. And as a result, by March 6th, the U.S. had completed just 2,000 tests, whereas South Korea had conducted more than 140,000 tests. So partially as a result of that, they have 256 deaths and we have almost 80,000 deaths. I find our testing record nothing to celebrate whatsoever.
There were harsh words from Senator Rand Paul toward Dr. Fauci. Senator Paul challenged Fauci's guidance on keeping children out of school to protect them from the virus.
I think we ought to have a little bit of humility in our belief that we know what's best for the economy. And as much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. If we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year.
You use the word we should be humble about what we don't know. And I think that falls under the fact that we don't know everything about this virus. And we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. We better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. I am very careful and hopefully humble in knowing that I don't know everything about this disease.
By the way, there's new polling that gives some indication of how the American public is feeling about Dr. Fauci right about now. 67% trust him for coronavirus information, while 36% trust the president. Another poll shows only 43% of Americans approve of Trump's response to the virus, while 71% approve of how their own state's governor has dealt with it. 56% disapprove of the president's effort, yet only 27% find fault with their own governor's effort. Trump has had his own explanation for governors' high ratings these days, and we quote, "Remember this, every governor who has sky-high approval on their handling of the coronavirus, and I am happy for them all, could in no way have gotten those numbers or had that success without me and the federal government's help. From ventilators to testing, we made it happen." On that note, let's bring in our leadoff discussion on a Tuesday night, shall we? Ashley Parker, Pulitzer Prize-winning White House reporter for The Washington Post. John Heilemann, national affairs analyst, co-host of The Circus on Showtime, editor-in-chief of The Recount. And Dr. Anne Rimoin, a professor of epidemiology at UCLA, where she runs the Center for Global and Immigrant Health, specializing in emerging infectious diseases. Good evening and welcome to you all. And Ashley, I'd like to begin with you for any reaction you've been able to gauge inside the White House about what they heard during today's hearing.
Well, two things. There were already people inside the White House, and to be clear, not everyone, but who were frustrated with the medical and public health professionals and who felt that they are being overly alarmist and who don't like that message, however true it may be, being public, because their focus is on trying to reopen the economies. But what was striking to me from his testimony was actually that clip you played a bit earlier, where he was making the point that is going to be what the White House is grappling with now. The president does want to reopen the economy. A lot of his advisors are also pushing him to do that. But as Dr. Fauci said, the public health advice and the public health side of this is actually tied to the economic side. If you go and you reopen too quickly and there are spikes in cases and outbreaks and deaths and they can't be contained, the economy is going to tank, as we've reported, and as the White House understands. This is as much about consumer confidence in psychology in many ways as it is about just simply opening up a grocery store or a nail salon or a restaurant and saying, go ahead, go spend your money. So those two parts have to work interchangeably, and that is what the White House is still grappling with right now.
John Heilemann, I want to play for you a moment from Tucker Carlson earlier tonight on Fox News.
Is this the guy into whom you want to vest all of your trust? Is this the guy you want to chart the future of the country? Maybe not. This is a very serious matter, the decisions we're making right now. Tony Fauci has not been elected to anything. He's had the same job for nearly 40 years. That means the majority of American voters never even indirectly picked him for the role he has now.
So, John Heilman, memo to self, it's the elected officials we should trust. Who's going to tell Jared? And I want to read you this from Liz Cheney tonight on Twitter. Dr. Fauci is one of the finest public servants we have ever had. He is not a partisan. His only interest is saving lives. We need his expertise and his judgment to defeat this virus. All Americans should be thanking him every day. John, what do you make of any or all of it?
Well, Brian, as you pointed out in the polling, a lot of Americans are, an overwhelming number are, thanking Dr. Fauci every day and grateful for the fact that he's there. In our society, in our politics, in our public square, for someone to have nearly a 70% approval rating is almost totally inconceivable. And so to hear our friend Mr. Carlson seeming to argue that the fact that he served in Republican and Democratic administrations alike, that he is someone who actually, he's done the same job. He's been someone who has expertise. He has tenure. He has a nonpartisan profile. And for some reason, those things add up to, we don't want to trust that guy. That tells you how messed up the situation is, Brian, that those are black marks in the eyes of some of our friends at Fox News about Anthony Fauci. And I think what's great about this moment is that Tucker Carlson can say that, and then you can read that opinion poll that says, you know what, Americans actually look at Tony Fauci and say, yeah, expertise, tenure, and nonpartisan affiliation, all this guy cares about is saving lives. And I'll say one more thing about Tucker Carlson. I don't believe there is a question on the table where anybody is thinking that they should arrogate all power over decision-making to Anthony Fauci. I don't think that's a question that anyone has raised. I don't think anyone expects Anthony Fauci to make every decision. But I think what we saw today after a president yesterday who lied repeatedly, detailed on this show and others, lied repeatedly in his press briefing yesterday, we got to see someone today who was focused on telling the truth. And I think that's another reason why Tony Fauci is at 70% and Donald Trump's in the 40s.
Anne Ramoyne, what did you make of today's hearing? Was it a battle between what we should be and what we are? Do you think both sides found enough to come away with their own specific arguments?
Listen, in this pandemic, we are thinking about public health, but we are being guided by politics here. And I think that it is very important as we think about what happened today to see how much politics were infecting how we hear public health advice. I think that Dr. Fauci was able to communicate very clearly the things that are very important for people to understand. Number one, we still have a long way to go. There is hope, but we cannot base what we are doing on hope. We need to base it on fact and on evidence and on science. And so, therefore, I think that it will be interesting to know what everybody heard today. But I think that everybody is hearing public health through various political filters. And, at the end of the day, what happens next is going to be is going to dictate where we are in terms of morbidity and mortality.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.